Welcome back. Woodbury County was one of the first counties in our state to report coronavirus among its residents. It's in a unique spot on the border of Nebraska. It has a packing plant population and also a large urban area. Local 5's Rachel Droz takes us to one of the hardest hit areas in our state. 3 individuals from Johnson County have tested positive.
105 cases across the state, 1,000 positive cases.
It's been a year.
Total cases have surpassed 50,000.
In just 12 months, a virus has taken so much.
Iowa has suffered its first death
from so many.
More than 1,000 Iowans have now died.
Tonight, we take you to one spot in Iowa hit hardest early on.
We got hit some of the hardest of anywhere.
Woodbury County, 100 miles north of Omaha.
When we got hit, it just came like a waterfall.
Tyler Brock is the deputy director for the Siouxland District Health Department.
It was a flood, and we were not, frankly, we weren't ready.
Data from the U.S. Bureau of Labor Statistics shows the Sioux City area is largely made up of blue-collar workers, employed at places like this Tyson plant, located in Dakota City, just over the Nebraska border.
Once it started in that population, we didn't feel like it was going to stop anytime real soon.
Health officials say high community spread likely started in plants like this. In late April, Tyson's Dakota City plant idled for 6 days to deep clean the facility and test all 4,300 of its employees. Hospitals around that time stretched thin.
When you're learning a lot of what you're doing from a treatment standpoint, from Facebook, COVID groups for physicians, learning what they think is working in New York at an ICU and hopefully trying to implement the same thing here.
Unsure if the treatment they were giving was helping or hurting.
A lot of it was really just doing the best that you can.
Dr. Larry Voles, chief medical officer at Mercy One Siouxland Medical Center, says during their first surge in late April, early May, the hospital was a scary place to be.
It's something that we've never had to experience really in recent years in medicine, and certainly hope we don't have to experience that again. And
the elderly and those with underlying conditions are most likely to get seriously ill or die from COVID. But Dr. Voles says many patients at that time didn't fit that description.
When we were seeing, a 48-year-old, Hispanic male come in from the meat packing plant with, going on a ventilator, those were really scary times. If these young, healthy people are getting sick from this, what is this really going to end up being?
Back then, personal protective equipment was in short supply. Doctors in this Iowa county competing with the rest of the world.
Me and one of my daughters driving to Home Depot and buying the N95s and face shields that they had because it was the only place that we could get them before the community brought them in, filling up the back of my pickup truck with painting masks because we weren't sure we were going to have enough to get through.
Data on the Siouxland District Health Department's website showing Woodbury County had 25 new positive cases reported the week of April 19th. A week later, there was 448 new cases. Another week, 667.
We went from testing, 10 to 20 people in the whole community every day to doing 400, 500 tests in a community testing clinic in one day.
A global pandemic.
We were not ready for that kind of volume.
Unlike anything modern America has faced before.
Turn towards me just a little bit.
December 2020, Americans got the news we've been waiting for. The FDA approved both the Pfizer and Moderna vaccines for emergency use. News that hopefully means this pandemic will soon be behind us. Woodbury County now holding weekly vaccine clinics.
Put your arm like that for me.
It's something many hope will be the answer to getting life
It's amazing to me that we're still doing this a year later.
back on track. In Sioux City, Rachel Droz, Local 5 News, We Are Iowa.
Our state leaders were forced to make very tough decisions at the beginning of the pandemic, and they continue to face issues today. One of the biggest players in keeping us all safe, Interim Public Health Director Kelly Garcia. She got the job just a few months into the pandemic. Rachel Droz again sits down with her tonight.
When you came to Iowa in late 2019, did you ever think today, a year and a half later, you would be director of 2 departments and dealing with a global pandemic?
Gracious, no. Absolutely not. But it's been, it's been an incredibly challenging year. I mean, beyond words, never could have imagined that this is what I'd be doing. But at the same time, it's allowed me to understand the connection points between our two systems. The pandemic has highlighted in a really tremendous way the fractures that we have in our healthcare delivery system. And so now we get to work on how to fix those.
Looking back, is there anything you think that should have been done differently here in Iowa?
I mean, certainly. I think in any emergency response, with hindsight, it's always 2020. You're going to look back and think, I wish I had done something different. Our real communications challenges, this insatiable desire to have information in real time while you're working to understand and things are constantly evolving, that has challenged even the best communication experts. And so I would go back and do things a little bit differently. I certainly would. And I think what I could say today is that we are taking those lessons learned every day. And again, trying to re-engineer the way we're communicating to make it easier to understand for Iowans so that they can take the actions they need to protect themselves.
Now tell me a few stories. Anything pandemic response related, just something that sticks out that you were a part of.
Sure. So I'll tell you the story that was the hardest for me. It was the day I closed visitation at our facilities. And it was right around a holiday. And I remember telling the parents of our families at Glenwood and Woodward that they wouldn't be able to see their loved ones. And I sobbed uncontrollably while doing it. It's making me a little bit teary while I'm telling you. To tell a parent, I had to do it on the foster care side as well. And to tell a parent that they can't see their child, it's heartbreaking. But it was the right thing to do at the time. We didn't know. I wanted our individuals to be safe. And I had the obligation to protect it. And they understood ultimately. And we lifted it as soon as we could. And now we're making some really good progress on vaccinations. But that was something that was, deeply behind the scenes, but an unbelievably painful and very it deeply rocked me as an administrator and as a parent.
Throughout the pandemic, many Iowans have made it a part of their daily routine to go online and check the latest COVID numbers. Cases, hospitalizations, deaths. They're all used to make decisions. Tonight, Local 5's Holly Schlusselman shares how Iowa's COVID data is organized.
Many changes have happened in the past year. The way we work, socialize, grocery shop, and more are completely different. But we're not the only ones that experience change. There wasn't always a dashboard to show COVID activity. I spoke with a state epidemiologist and a data analyst on these changes and what Iowans should know moving forward. The state confirmed the first 3 novel coronavirus cases on March 8th. Back then, Governor Reynolds' office would send out press releases detailing the age and county of residence for the positive individual. It wouldn't be until May that we would finally have a functioning dashboard for Iowans to see virus activity.
And there's been a lot of evolution over the last 2 or 3 decades in how we communicate in general, right? Not just around public health or health topics. So I think this idea around the information that we need to share is an important one. And it's one that I think we're learning more about and about what are better ways to do it.
Around July, data collectors discovered the state was backdating cases and deaths. This caused shifts in the data presented, and it wasn't until August 29th that the state confirmed their problems.
They didn't have a way to move forward the positive that actually occurred on the day that it did. And I remember thinking, oh my God, this is going to completely shift what the data looks like.
Backdating means the state attributes a positive test to the day the person tested positive. So if I was tested on December 10th, that's the date the state will assign my test to, not the day that I received my result. Because of the data change, the graphs all shifted and ended up looking smooth, closer to the graphs that we see today. Also in August,
that large data dump of antigen tests, which kind of screwed with the positivity rates for 14 days. But on the front end, for the rest of us, it looked like they added in thousands and thousands of tests on one exact day.
The November surge came and went. Iowa saw its highest number of hospitalizations, deaths, and cases. In December, changes were made in death reporting. And just over 2 weeks ago, the state no longer reports individual positives, only tests. Both Pedotti and Willett told me that while reporting 24-hour changes in data is good, Iowans should look at trending data like percent positivity, hospitalizations, and deaths to determine how safe their community is. We'll dive deeper on specific changes as the week continues. Reporting in the studio, Holly Slosselman, Local 5 News, we are Iowa.